Nurse Aide Test Prep Booklet. Question 1. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A, place items on the left side to encourage use. Option B, place items on the right side where the client can reach them. Option C, ignore the weakness. Option D, restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 2. Which approach is best for a client with dementia who becomes agitated during personal care? Option A, use a firm tone to assert authority. Option B, provide simple explanations and allow choices when possible. Option C, complete care quickly regardless of the client's response. Option D, skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example: would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 3. Which position is best for taking a rectal temperature? Option A, Fowler's position. Option B, dorsal recumbent. Option C, Sims position. Option D, supine position. The correct answer is option C, Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 4. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 5. The nurse aide's responsibility with advanced directives includes: Option A, helping the client complete advanced directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advanced directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advanced directives and inform the nurse of any issues. The aide does not assist in completing advanced directives, make decisions for the client, or explain legal documents to the family. Question 6. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C, given a sedative. Option D, ignored until they calm down. The correct answer is option B, encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 7. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B, approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 8. Which precautions are used for clients with MRSA or VRE? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions only. The correct answer is option C, contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 9. When a client dies, the nurse aide should: Option A, leave the room immediately. Option B, provide post-mortem care. Option C, call the family. Option D, remove all personal belongings. The correct answer is option B, provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 10. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 11. Which statement demonstrates therapeutic communication? Option A, you should not feel that way. Option B, everything will be fine. Option C, tell me more about what happened. Option D, I know exactly how you feel. The correct answer is option C, tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 12. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C, report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 13. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B, place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 14. A dying client is breathing irregularly. The nurse aide should: Option A, call the nurse immediately. Option B, continue to provide comfort care. Option C, administer oxygen. Option D, start CPR. The correct answer is option B, continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 15. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 16. A client who is withdrawn and refuses to speak to anyone is likely experiencing: Option A, depression. Option B, anger. Option C, excitement. Option D, anxiety. The correct answer is option A. Depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 17. The nurse aide is caring for a client who speaks a different language. The best approach is to: option A, use hand gestures and hope the client understands. Option B, speak loudly and slowly. Option C, use a trained medical interpreter. Option D, ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 18. When using a fire extinguisher, the nurse aide should remember the acronym. Option A, pass, pull, aim, squeeze, sweep. Option B, race, rescue, alarm, contain, extinguish. Option C, ABCD, airway, breathing, circulation, defibrillation. Option D, pace, pull, aim, contain, extinguish. The correct answer is option A. Pass, pull, aim, squeeze, sweep. PASS is the correct acronym for using a fire extinguisher. RACE is for fire response, rescue, alarm, contain, extinguish. PASS is specifically for extinguisher use. Question 19. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 20. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: option A, document this as normal. Option B, report it to the nurse immediately. Option C, reposition the sensor and wait. Option D, increase the client's oxygen. The correct answer is option B, report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 21. The apical pulse is located at the: option A, wrist. Option B, neck. Option C, apex of the heart, 5th intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 22. When performing passive ROM exercises, the nurse aide should: option A, have the client perform the movement independently. Option B, move the client's joint through its full range of motion. Option C, force the joint beyond its range. Option D, perform ROM exercises only once a week. The correct answer is option B, move the client's joint through its full range of motion. Passive ROM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 23. A client has difficulty adjusting to a new facility. The nurse aide should: option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B, allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 24. What does the abbreviation ADL mean? Option A, ad lib. Option B, as doctor likes. Option C, activities of daily living. Option D, after daylight. The correct answer is option C, activities of daily living. ADL stands for activities of daily living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aid practice. The other options are incorrect medical abbreviations. Question 25. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing.